Hi, my name is Dawn. I'm a psychiatric mental health nurse practitioner. I work in dual diagnosis addictions and also primary mental health in an inpatient unit and do some outpatient services as well. I often do groups with my patients, and because this is Mental Health Awareness Month and because my patients often ask me if we have a YouTube channel or if we have a TED Talk, we thought we would talk about a few of the topics that we talk about while we're in our inpatient units with the patients as they're trying to recover from a mental health crisis. Our goal is to normalize the human experience. Everyone has mental health issues or knows someone who does. So we're going to get started on a few topics. My favorite, 10-80-10, learning how to live in the moment. We're also going to talk about how the brain develops. We're going to talk about the masks that we wear and the filter that we use when we're interacting with other people. So those are just a few of our topics. Hope you'll stick around with us as we walk on the journey. And so let's get started. Hi, my name is Dawn. I'm a psychiatric nurse practitioner. I work in dual diagnosis addictions and primary mental health in an inpatient unit. I did an introductory video, so if you're back from that, we've made the journey from the desk to the whiteboard. And as promised, we're going to talk about 10-80-10. I like to use this with patients when they first come in because we need to do a reset button. We need to start over again. And this is a really good way to teach patients mindfulness, how to be in the moment, and how to start dealing with the past, not staying in the past, and also how to put the future in perspective. So 10-80-10, very simple. 10% in the past. Learn from your mistakes, but honestly, you really have to get over yourself. We're all human beings. We all make mistakes. A lot of us repeat those mistakes because we're trying to change the past, which we can't do. It's against nature for us to dwell in the past and relive our mistakes over and over and over again, trying to come up with a different outcome. As human animals, we try to do this. If a bear goes down a path in the woods, gets caught in a trap, if he gets out of the trap, he doesn't go to his den, lick his wounds, tell himself how stupid he is, and want to die, he just doesn't go down that path again. But for some reason, we think we shouldn't make mistakes. This is the human journey. This is the human experience, and guess what? We're going to make mistakes. But for some reason, some of us can't deal with the fact that we've made a mistake. Maybe we've harmed ourselves or others. But we can't change the past by reliving it over and over again. And when we dwell in the past, our mind thinks we're still in the past, thinks we're still making those mistakes, and that depression kicks in. So people who dwell in the past suffer from depression. 10% in the future. You can plan for your future, but don't get stuck emotionally in the future either. A lot of my patients dreamt for something more for themselves, okay? And so then they wind up in this grieving process of a fantasy. So when I have a patient who is suicidal, let's say because a boyfriend broke up with them, and I'm talking to that patient about the situation with the boyfriend, most of the time I find out that the boyfriend wasn't really a very nice boyfriend. But they had fantasized about a life with this person. And of course, it was a good fantasy, right? They fantasized that this person was going to be the love of their life and they were going to have 2 children with them and a blue house and a white picket fence. And so they created this fantasy. And then when that boy leaves or breaks up or whatever happens, they're having to grieve the fantasy, not the reality of what the relationship was. So many times I'm having to kind of pull these patients back and say, wait a minute. Are you really grieving the reality of the situation or what you imagine the situation would be? So many times when we kind of settle into our thoughts about a situation and we're anxious and we're feeling horrible and we're grieving something, we need to check in with ourselves and ask ourselves, are we grieving the reality of the situation or the fantasy that we created? So that's really, really important. Now, how do we plan for the future? How do we give it that 10%? So addicts and alcoholics, typically we think in extremes. So if I see a freckle, I might look at that freckle and I'm going to do one of 2 things. I'm either going to ignore it or within a split second, I'm going to be planning my funeral because that's how addicts and alcoholics think. So how do normal people think? Normal people pick up the phone, call their doctor, and say, hey, I saw a freckle and it looks a little funny. So can I get in to see you? Sure, great. Wednesday, 2 o'clock, sounds good. Normal people don't think about that again until Wednesday at 2 o'clock. That's giving it 10%. Now, let's say your taxes are due and you're thinking about, oh my gosh, last year was horrible when I had to pay my taxes. It was an awful experience. So you get into the depression of that past. And then you think about, oh my gosh, I'm going to have to plan everything out. I'm going to have to get my files out. I'm going to have to talk to the accountant. So anxiety. And most of us really are about 45. Past is depression, future's anxiety. Or you could give it 10%. I'm going to put on my calendar that next week, for an hour, I'm going to gather all my documents. And then I'm going to call my accountant. So that's 10% that you're giving it in this moment and not wasting this moment on something that you can't control. So 80% in the moment. This is mindfulness, right? This is living life in the moment. When you wash your hands, feel the soap, smell the soap, feel the warmth of the water. When you get in the shower, feel the warmth of the shower. Have gratitude that you're stepping into this shower. When we're thinking about what we're going to do next, or we're thinking about what we did in the past, we're missing life, because this is where life is actually happening. And there's a lot of dynamics around this that have to do with our survival mechanisms and our fear, our trauma, always trying to preempt harm. That's where we get into fight, flight, freeze, or fawn. So, fight, flight, freeze, or fawn. You guys are going to have to hear my baby fox story. You're the one who clicked on the play button. Fight, flight, freeze, or fawn, baby fox story. That'll be in our next video. Thanks for watching.